grant itself has been huge and incredibly helpful. This was the first grant I'd ever written, and it's the first grant I ever got. And it was one of the happiest days of my fellowship when I got the news that my application was selected. It's a very unique experience being an early investigator. It's sort of challenging because so few grants are funded these days. So to have a patient-driven organization that takes a special interest in my research, it's really an incredible feeling of support as a junior investigator to receive one of these fellowships.
As a medical oncologist, the way that I tend to think about research benefiting patients really is the clinical trial arena. Introducing new drugs, new targets, finding new targets, and defining when these targets work and when they don't in different patients with different tumors is really important. And I think for larger clinical trials, that generally requires a lot of funding from the NIH or for philanthropists, but the scale of funding needed for a clinical trial, of course, requires an incredible amount of solid preclinical data. And I really think that's where some of these early career grants come in, is that they help you generate this small amount of sound data with a very kind of targeted trial at the endpoint. And with this small amount of data, you can apply for much larger grants that would help fund a larger clinical trial. And that's really where the patient engagement comes in and potential benefit, really just increasing the landscape of clinical trials that we have available to cholangiocarcinoma patients.
We're getting a better sense of which patients benefit from some strategies versus others. What's more, putting all of this together, the funding support from CCF has allowed us to now prepare to launch a randomized phase 2 trial asking key questions about when multimodality therapy will help patients most with cholangiocarcinoma. And consistent with the spirit of CCF, this has been done in partnership with CCF through patient advocates and really reflects a trial that is designed with patients at the center, measuring improvements in quality of life, measuring improvements in quantity of life.
We hope that we can just provide a little bit of some additional strategies to make the response rates that we're seeing in patients even better.
I find that really exciting to really be able to see and actually do and contribute in my own way this life cycle of research to clinical trials. And at a certain point I'll hand it off to the phase 2 and phase 3 investigators, and hopefully it'll make a difference. Well, that's really what you really hope for and what you're aiming for in the end with all of this effort. So I think it's been great.